Morning, sir.
Ladies and gentlemen, please give a quick round of applause for Shri Dinesh Gundu Rao sir, our Honorable Minister, Health and Family Welfare, Government of Karnataka. We welcome you, sir. Can we have a bigger round of applause? Come on, leaders. ನಮ್ಮೊಂದಿಗೆ ಶಾಸಕರಿದ್ದಾರೆ ನಮ್ಮ
and a very warm welcome. Happy Navaratri to all. It gives me a great pleasure to welcome you all for the State Family Planning Summit, New Choices, New Horizons. I extend my warm greetings to Honorable Shri Dinesh Gundu Rao sir, Health Minister, State of Karnataka, the energetic force of health and family welfare. In absentia, I also welcome Shri Jati Dakkar, ACS, Health Education, and our own Shri Anil Kumar DK, Principal Secretary, Health and Family Welfare. I warmly welcome Shri D. Randy, Commissioner, Health and Family Welfare Department. In absentia, I also invite Dr. K.V. Trilok Chandra, Special Commissioner, DDMP, Dr. Naveen Bhatt, Mission Director, State of Karnataka, and Ashok Babu, Joint Secretary, RCH, Ministry of Health and Family Welfare. I warmly welcome Dr. Pavan Kumar, Additional Commissioner, Family Planning, Maternal Health and Immunization. I warmly welcome the WHO representative to India, Dr. Rodrigo H. O'Brien, who found the time to attend this event, and his whole WHO team from New Delhi, who have been working relentlessly to make this event a success. I also welcome my friend Dr. Srinivas, Project Director, to this summit. I welcome wholeheartedly all my colleagues, media persons, and other officials gathered here. This new horizons. Today, we will embark on a new journey of providing our people and empowering women with two new contraceptive choices: single rod subdermal implants and subcutaneous injectable MPA. These two new contraceptives were introduced in the public health system by Ministry of Health in March 2023, and 10 states were chosen for the first phase of introduction. It is an extremely proud moment for us that State of Karnataka is one of the chosen states where these contraceptives are being introduced in 4 districts: single rod dermal implant in Bengaluru and Bidar, and subcutaneous injectable MPA in Mysore and Yarkir. The national and the state teams have been relentlessly working together for the implementation and rollout of these new contraceptives. We have oriented and trained our service providers across all the 4 districts and initiated our awareness and advocacy campaigns. Today, in the presence of our esteemed guests, we officially announce the launch of the new contraceptive choices in our state, with the availability of these services across all the selected state facilities, as well as the launch of the information and advocacy material on new contraceptives. Looking forward for a fruitful day. Thank you.
I've met him earlier. You will see him again a bit later. Commissioner Health and Family Welfare, Dr. Pavan Kumar, of course. Additional Commissioner, Family Planning, Maternal Health and Immunization, Government of India, Ministry of Health and Family Welfare. Dr. Srinivas, Project Director, RCH, Government of Karnataka. Dr. Indumati, Director, Health and Family Welfare, Government of Karnataka. Of course, other dignitaries of the dais, district officers for whom this whole launch would not have been possible. Partners like SIF, or the Children's Investment Fund Foundation. Ladies and gentlemen, colleagues, dignitaries, namaskar. I will begin by expressing my heartfelt appreciation and congratulations to the National and State Government of Karnataka for their unwavering commitment and dynamic leadership in pioneering this family planning initiative. This is the first launch in India, and I think it's so apt that it is happening in the government of Karnataka. I do recall the time when Dr. Sikdar wrote me a note and said there are 3 states that you will have to do, and one of them is Karnataka. And I said, okay, yes, go. Well, there may be challenges, but I think together we will be able to do it, and here we are today. The actions taken today under the Family Planning Program will define our future, and more importantly, our children's future. Science, human rights, public policy play significant roles in shaping family planning methods and access to reproductive health services. It's so crucial that it is in this one area that all these 3 come together. It is heartening for me to know that India has embraced new advances and tools to expand the basket of spacing and contraceptive methods, as well as increase the access to reproductive health information and services. Access to spacing and contraception methods is not just a health priority, but also a reinforcement of, as I said, several human rights, from the right to life, liberty, right to education, work, and most of all, the right to quality of life. Historically, family planning has been a key strategy to protect and promote maternal and infant health. Though India has achieved much in this realm, much more can be done. I believe we're on our path to success in that direction. I think it's now time to shift that narrative of family planning from being just a means to reduce family size and reduce maternal infant mortality, but a right to high quality life. More importantly, a value-based service that empowers women. I repeat that, it's empowering women and their choices and their lives as a whole, looking at it as something holistic. There remains a substantial need for modern contraception methods in India, and Karnataka is no exception. March 2023 marked a crucial turn in India's family planning journey, with the Government of India expanding the contraceptive spectrum to include implants and injectables. Such reversible forms of contraceptives have the potential to refine birth spacing, which is a crucial need across states. Data shows that 56.2% of births in Karnataka are inadequately spaced. That's as per the sample registration survey of 2020. Any initiative, however well-intentioned or well-planned, is only as good as its implementation. And this is where the role of WHO, okay, I will stop there. Of contraceptives have the potential to refine birth spacing, which is a crucial need across states. Data shows that 56.2% of births in Karnataka are inadequately spaced. Any initiative, however well-intentioned, as I said, or well-planned, is only as good as our implementation, and that is something we all need to partner together and work on. WHO is very well committed to support the government of Karnataka in executing the program with diligence, with passion and precision. WHO support to the government of India, particularly in expanding contraceptive options and supporting states like Karnataka, West Bengal, and Delhi, is a source of immense pride for all of us. It's a huge challenge, but we have taken it on, and that partnership together with all of you will make it a success. Some of the contributions of the WHO team for sexual reproductive health, many of whom are here today, is to provide technical support in creating the reference manual and operational guidelines for this, facilitating the training of 31 service providers through Family Planning Association in India and 10 pilot states, supporting planning, capacity building, implementation, and monitoring in Bengaluru, Bidar, Yadgir, and Mysuru, aiding the creation of a customized technical and promotional materials, many of which you will see later. Going forward, we will systematically record progress and gather insights to guide future strategies through implementation research and share this with other countries. In one visit I had in a health and wellness center in Delhi, together with the chief scientific advisor for health of the UK, she was very surprised with the huge basket of services that was available in that health and wellness center. So there are things to learn. Even for the developed world, they will have to learn from India. I'm sure that under the dynamic leadership of the esteemed minister, and the family planning program in Karnataka will gain further momentum and set new benchmarks for success for other states to emulate. Thank you to the state government of Karnataka and of course the government of India Ministry of Health and Family Welfare for all the trust. Working with you in partnership is truly a privilege. As we forge ahead, WHO renews its commitment to support the expansion of the contraceptive basket in India. Thank you very much.
Shri D. Randeep, Commissioner, HW, Government of Karnataka. Dr. Pawan Kumar, Additional Commissioner, Family Planning, MH and IMM, Government of India. Dr. N. Indumati, Director, HFW, Government of Karnataka. Dr. Srinivas, Project Director, RCH, Government of Karnataka. Jewel Chapaya.
Karnataka, Shri Randeep, Dr. M. Indumati, Director of Family Welfare, Government of Karnataka, WHO Representative to India, Dr. Rodrigo Offering, Dr. Srinivas, Project Director, RCH, distinguished guests of the dais, Dr. Sikar, my WHO colleagues, state officials, district officials, ladies and gentlemen. I extend my heartiest greeting from Ministry of Health and Family Welfare, Government of India. At the outset, I wish to congratulate Karnataka State for taking a leap towards an expanding contraceptive basket. Government of India sees this step as an important vector in India's journey towards universal health care. India's landmark National Family Welfare Program, first in the world, has gifted us the resilience, vision and lesson to innovate and strategize effectively for the future. The recent NFHS 5 data served as a reaffirmation of India's dedication efforts and the subsequent positive outcomes in enhancing reproductive health across the nation. India has achieved a significant demographic milestone with the total fertility rate dropping below the replacement level for the first time less than 2. Additionally, there has been substantial increase in the use of modern contraceptives, rising from 47.8% to 56.5%. Furthermore, the unmet need of family planning has decreased, dropping from 12.3% to 9.4% as per NFHS 5 data. These trends also reflect a favorable shift towards adoption of spacing methods with an increase in usage of various spacing methods. While India and Karnataka have maintained the replacement level less than 2, the narrative goes beyond just fertility here. The family planning program has multifaceted benefits ranging from maternal and childhood to gender equality, even environmental poverty alleviation and addressing to the food crisis. Launching expanded family planning options on the World Food Day, that is 16th of October, is quite fitting. In the esteemed presence of Karnataka's Honorable Health Minister, I wish to discuss current and future priorities, sir. Family planning is and will be the priority for India. 3 crore people will be added to the adolescent and reproductive health cohort in India in the coming decade, from 2021 to 2031. 1.2% of this population will be contributed by Karnataka, 34 lakh people. 61% of population of Karnataka will be in the needs of sexual and reproductive health services in 2031. In recent years, Karnataka made significant improvement in improving its contraceptive access, contraceptive use, witnessed an impressive increase of 17%, second highest increase among the largest state, from 50.3% to 68.2%. However, the priority for the state remains for increasing modern contraceptive use among the young and low parity women. The modern contraceptive use declined to 34% in young women and low parity women. Dr. Rodrigo emphasis on teenage sexual reproductive health and the alarming trend in contraceptive use and unsafe abortions among the group cannot be ignored. That is why there is a need of contraceptives and expanding the basket of choice. Karnataka's family planning efforts are undeniable. In its continuous endeavor to improve health of people, government will expanded the basket of contraceptive choices with increase of single rod, subdermal implant and SC-MPA injections. This is one of the game changer strategies of India's family planning program. We all are aware that additional dent on the state's maternal mortality will demand a comprehensive strategy that impacts the birth spacing practices and addressing the need of postpartum women in the state. Long-acting reversible contraceptives like implants and MPA injections has the potential to impart a contraceptive method mix in the state. This will also increase the options for postpartum women. Presently, in Karnataka, 29.7% postpartum women are being offered either postpartum IUCDs or postpartum sterilization. 21.6% PPICD acceptance and 8.1% postpartum sterilization services. The two new contraceptives are effective options for the postpartum period among the women. The selection of contraceptive methods should be tailored to meet the unique needs and preferences of the women. Additionally, it is crucial to recognize that each contraceptive method comes with its own set of advantages and disadvantages. Therefore, it is imperative that the client receive the comprehensive information about these methods to enable them to make well-informed decisions regarding which method aligns best with their individual circumstances and their need. The state would need strategies to engage health workers specifically in contraceptive promotion. If we see the NFHFI data, only 36% of health workers, they have even talked to the clients for the family planning program. So there is a need of awareness and a correct knowledge to the healthcare providers among the health workforce which is working the field level. We followed a strategic approach after the inclusion of new contraceptives in the basket where technical and programmatic guidance was drafted at the national level in the presence of domain experts from the entire country as well as review of international experts. In phase 1, 10 states are being covered for introduction. Concerted efforts led to the training of 31 master trainers in 3 batches across the country. Karnataka was one of the sites where the participants from the western and southern part of the country they were trained. The state has been provisioned 10,000 implants, 20,000 doses of subcutaneous MPA injections. Government of India also supported state with the training aid like 60 placebo implant, 20 arm models, etc. It gives me immense pleasure that the state took it steadfast with the support of WHO, developed a comprehensive micro plan, identified the facilities and has trained 12 more trainers for implants, and the services delivery for implants has already been started. For SC-MPA, WHO supported with initial orientation and state is strategizing, effectively utilizing the existing pool of trainers. But we should not sit on our laurels. This is a time which will demand a careful monitoring for the quality services among the contraceptive basket and demand generation effort so that the commodities they are fully utilized for the people which are in need. As a technical agency or developer organization also has a role to play so that clients are offered with expanded contraceptive choices and quality care. With these initiatives, India has marked its first milestone towards FY 2030 aims and goals. I express hope that this one-day summit will bring all stakeholders together to bring family planning at the forefront and expansion of contraceptive services a success story in the country.
Version of IEC posters on single rod implants developed by the government of Karnataka. IEC posters on contraceptive implants are launched ಆಗ್ತಾ ಇದೆ. ಜೋರಾದ ಚಪ್ಪಾಳೆ ತರಬೇಕು. Moving on, I now request the dignitaries to unveil the technical and demand generation material developed to facilitate the effective implementation of the family planning program in our state. These materials have been developed with support from WHO Summer Team and WHO Country Office for India. Ladies and gentlemen, the dignitaries are now launching the ASHA brochure, ASHA booklet for family planning, which contains important information on all contraceptives under the National Family Planning Program, including the new contraceptives, single rod implants, and subcutaneous MPA injection. Yes, sir. జోరుగా చెప్పాలి ఎవరు? Thank you so much, sir. Congratulations. Best facility for
ಮೇಡಮ್ ಒಂದು ಸ್ವಲ್ಪ ಮುಂದೆ ಬನ್ನಿ ನಾನು ಮುಂದೆ ಹೋಗ್ತೇನೆ
highest feeling is sterilization, sir. Next category is overall best district operationalization in FPLMIS is Dr. Dilip Domble. Next category is highest number of implant and insertions done among 4 facilities with best counselor goes to Dr. Indra Kavadi, Dr. Shashikala, Dr. Reena. This is the team from KC General Hospital. Can we have the entire team on stage, please? Dr. Shashikala, Dr. Reena, Dr. Indra.
ಮೇಡಮ್ ಮುಂದೆ ಮೇಡಮ್ ಸ್ವಲ್ಪ ಈ ಕಡೆ ಮೇಡಮ್ ಇಲ್ಲಿ ನೋಡಿ
Best Asha, next category. Asha with highest motivation. Can we have Srimati Sujata on stage, please? Srimati Sujata. Next is standing for additional felicitation for their contributions. Can we have Dr. Shobha Guri, FOGSI, State Chapter? Dr. Shobha Guri. Dr. Padmi Prasad. So, ladies and gentlemen, on stage we have Dr. Padmi Prasad, FPI and FOGSI, Bengaluru. Congratulations, ma'am.
ಮೇಡಮ್ ಒಂದು ಸ್ವಲ್ಪ ಮುಂದೆ ಬನ್ನಿ
Next, we have Dr. Ratnamala Desai, FPI President. Can we have you on stage, ma'am? Next, can we have Dr. Shashank, Master Trainer in Plants, on stage, please? Dr. Shashank, Master Trainer in Plants. Next, can we have Dr. Shivraj, who is the best counselor? Dr. Shivraj. We have a special felicitation. Now we would like to say speaker yesterday, ex-additional commissioner and advisor family planning. I request our honorable Minister Sir to translate Dr. Sikar. Joda Chappada, come on, ladies and gentlemen. He's been our mentor and guide for our state for many, many years. Congratulations, sir.
Here. Okay, I was a little bit lost to talking about the one doctors and individual sir and individual. My name is Sandhya. I'm working in the Art College as a guest lecturer as a physics for the post of physics. So ಇದು ನನ್ನ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಏನಂತ ಹೇಳಿದ್ರೆ ಇದು ಇಂಪ್ಲಾಂಟ್ ನನಗೆ ಫಸ್ಟ್ ಗೈಡೆನ್ಸ್ ಕೊಟ್ಟಿದ್ದು KCC ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಡಾಕ್ಟರ್ ಶಿವರಾಜ್ ಡಾಕ್ಟರ್ ಇದು ತುಂಬಾ ಎಫೆಕ್ಟಿವ್ ಆಗಿರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರು. ಬಿಫೋರ್ ದಟ್ ನನಗೆ 1 ವರ್ಷದ ಮಗ ಇದ್ದಾನೆ. ಸೊ ನನ್ನ ಪ್ಲಾನಿಂಗ್ ಅಂತ ಹೇಳಿದ್ರೆ ನನಗೆ ಒಬ್ಬನೇ ಮಗು ಸಾಕು ಅಂತ ವಿ ಆರ್ ಪ್ಲಾನಿಂಗ್. ಬಟ್ ಫಾರ್ ದ ಟೈಮ್ ಬೀಯಿಂಗ್ ಒಂದು ಸ್ವಲ್ಪ ದೊಡ್ಡವನಾಗಬೇಕು, ಸ್ವಲ್ಪ ಟೈಮ್ ಬೇಕಾಗಿರುತ್ತೆ ಅಂತ ಹೇಳಿಬಿಟ್ಟು ನಾವೇನು ಮಾಡಿದ್ವಿ, ಫಸ್ಟ್ ಐ ವಾಸ್ ಗೋನ್ ವಿತ್ ಕಾಪರ್ಟಿ ಬಟ್ ಇಟ್ ವಾಸ್ ಫೇಲ್ಡ್. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನಾವೇನು ಮಾಡಿದೆ, KCC ಹಾಸ್ಪಿಟಲ್ಗೆ ಹೋಗಿ ಮೀಟ್ ಮಾಡಿದಾಗ ಸೊ ಶಿವರಾಜ್ ಸರ್ ನನಗೆ ಗೈಡೆನ್ಸ್ ಹೇಳಿದ್ರು ಇಂಪ್ಲಾಂಟ್ ಬಗ್ಗೆ. ಸೊ ಇದು ಇಂಡಿಯಾದಲ್ಲಿ ಅಷ್ಟು ಪಾಪ್ಯುಲರ್ ಆಗಿಲ್ಲ. ಸೊ ಹಾಗಾಗಿ ನನಗೆ ಗೊತ್ತಿರಲಿಲ್ಲ ಅದ್ರ ಬಗ್ಗೆ ಅಷ್ಟೊಂದು. ಸೊ ಅವ್ರು ಹೇಳಿದಾಗ ಓಕೆ ಟ್ರೈ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಾನು ಇದು ಇಂಪ್ಲಾಂಟ್ ಹಾಕಿಸ್ಕೊಂಡೆ. ಲಾಸ್ಟ್ ಮಂತ್ 16 ನಾನು ಇದನ್ನ ಇಂಪ್ಲಾಂಟ್ ಹಾಕಿಸ್ಕೊಂಡೆ. ಓನ್ಲಿ ಒಂದು 1 ವೀಕ್ ಇದು ಅಷ್ಟು ಪೇನ್ ಇರುತ್ತೆ, ಬಟ್ ಅದಾದಮೇಲೆ ಇದು ನಾವು ಹಾಕಿಸ್ಕೊಂಡಿದ್ದೀವಿ ಅಂತ ಅನಿಸೋದಿಲ್ಲ ನಮಗೆ. ಸೊ ಐ ಥಿಂಕ್ ಇಟ್ ಈಸ್ ಬೆನಿಫಿಷಿಯಲ್ ಟು ಈಚ್ ಆ್ಯಂಡ್ ಎವ್ರಿ ಯಂಗ್ ವುಮೆನ್ಸ್ ದೋಸ್ ಹೂ ಆರ್ ಮ್ಯಾರಿಡ್. So thanks for each and every one for this innovation for the students and whole doctors family. Okay, thanks.
ನನಗೂ 3 ಮಕ್ಕಳು. ನನಗೆ ಆಪ್ರೇಷನ್ ಮಾಡೋಕ್ಕೆ ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಯಿತು. ನಮ್ಮ ಹುಡುಗರು ನೋಡ್ಕೊಳ್ಳೋಕ್ಕೆ ಯಾರಿಲ್ಲ ಅಂತ ಆಪ್ರೇಷನ್ ಮಾಡಿಸಿಲ್ಲ. ಮ್ಯಾಮ್ ಹೇಳಿದರು, ನೀನು ಇದು ಪ್ರಾಬ್ಲಮ್ ಬರೋಲ್ಲ, ಈ ಥರ ಒಂದು ಇಂಜೆಕ್ಷನ್ ಬಂದಿದೆ, ನೀನು ಇದು ಹಾಕ್ಸ್ಕೊ, 3 ವರ್ಷಕ್ಕೆ ಏನೂ ಆಗಲ್ಲ, ನೀನು ಒಳ್ಳೆಯದಾಗುತ್ತೆ ಅಂತ ಮ್ಯಾಮ್ ಹೇಳಿದರು. ಅವ್ರ ಮಾತು ಕೇಳ್ಕೊಂಡು ಬಂದು ನಾನು ಇಂಜೆಕ್ಷನ್ ಹಾಕ್ಸ್ಕೊಂಡೆ. ಈಗ 4 ದಿವಸ ಆಗುತ್ತೆ. ಇದರಲ್ಲಿ ಏನು ಪ್ರಾಬ್ಲಮ್ ಬರ್ತಾಯಿಲ್ಲ, ಎಲ್ಲ ಚೆನ್ನಾಗಿದೆ, ಪರವಾಗಿಲ್ಲ. ಮ್ಯಾಮ್ ಅವರಿಗೆ ತುಂಬ ಥ್ಯಾಂಕ್ಸ್ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ನಾನು.
Underwent implants at the Hosalli Referral Hospital in the BBMP this time. So she was a great sportive because many of them were hesitating when they came also, but she stood back. After seeing her, another 2 also got motivated, and we got the implant done. And I'm grateful to KCC Hospital, Dr. Shashikala, who did the implant. Thank you.
Planning Summit that is organized today in Bengaluru with the slogan New Choices, New Horizon. I would like to welcome the member, the representative of WHO to India, Dr. Rodrigo Orphan, to this program. Also we have with us Dr. Pawan Kumar, the Additional Commissioner of India, in charge of this program. On the dais, we have our Commissioner, Sri Randeep, our Director, Indumati, and Dr. Srinivas, and all the other officers of the department and members, representatives of the WHO, and various other representatives from across the state, from different organizations, and also all the award winners who have performed extremely well in family planning across Karnataka, and dear media friends. So a very important launch is taking place today, because family planning is something that has been a very core subject for India since independence, since they recognize that the population of India, which was growing very, very rapidly, needs to be under control, and we need to have good family planning methods to see that unwanted pregnancies and unnecessary childbirths won't take place. With two main goals in mind. One, of course, is to see that the burgeoning population is controlled. And of course, the second most important thing is that the women have control over their own bodies and their own futures. So, childbirth is something which most men don't take much responsibility for. So, even in family planning, I don't think most men take much responsibility. So, it is left to the women to manage their own family planning methods. And there have been many methods that have been evolved over a period of time. Oral contraceptives, then surgical procedures, then sterilization methods, and of course use of condoms, all these things. But I think technology has been growing. Use of better ways of family planning have been coming into play, and oral contraceptives are playing a big role. And of course, now with this, I think this can be something which will be really liberating the woman, I feel. These single rod subdermal implants and injections, MPA injections, which are being launched today. It's already been under trial for quite some time. But now in 10 states it's being launched, and I want to thank Government of India for including Karnataka as one of the launching states where they will use this. And Karnataka has always been progressive in always adapting and using new methods in whichever field that there is, whether it's medicine or any other field. So this is a good state for you to use and launch it, since we have a good team of people. And I think 4 districts have been taken: Bangalore, Mysuru, then Yadgir, and one more district. Bangalore as well, Mysuru, Yadgir, and one more district. Bidar. So 4 districts have been taken for this, and I'm sure that it's a matter of time before all the districts will come under this program, and the entire country will come under this program, because it's already been well established. It's a method that is, I think, widely being used all around the world, and the usage and the friendliness that it gives, the advantages are many, and I think already the experts have spoken on that. The advantages of using this single rod implant, which lasts up to 3 years. So I think that is something which is wonderful for a person. And the important thing is it's easily reversible. That is the big advantage. It's easily reversible. So for a woman, I think especially for whether they're married or unmarried, there are so many times when pregnancies happen which they would not have wanted it to happen. And for that, I think these methods will, I think, be a great boon to the girls and the women of our state, and it gives them, the freedom to take decisions and the freedom to have, to have a more fulfilling life, more healthy life, and to avoid, unnecessary pregnancies, and to be, able to live up to when do they want to have a child, how do they want to have a child, and whether to have a child or not. All 3 concepts come into this: whether to have, when to have, and how to have. So all these factors, it will become the decision of the woman, and she can take greater control. So when Karnataka has been doing well, like you said, whether in terms of bringing down the teenage birth rate, whether increasing the prevalence of use of contraception, and also the decrease for the people who have their needs have not been met. So Karnataka is doing well in terms of family planning, even in terms of TFR ratios well below replacement levels now, and like most southern states, I think our population replacement rates have gone below, is in the negative. So our populations are decreasing, and that is also causing us other problems in terms of economic and political strength. So hopefully that doesn't cause more problems for us. because those states which develop on the right lines should get more encouragement from the center. And states which are doing well, states which are performing well and are trying to reach the developed status, they should be pushed more to achieve more. So I hope that Government of India and the Health Department will give more support to our state, not only in the family planning program but in every other program, and we will try and do our best to see that whatever the aims and targets of the Government of India is, we will try and reach that, along with our own targets that we perceive that is important for us. So with these words, I would like to thank all of you for having organized this, and I think we will give good focus to this program and see that whatever that you supply to us gets exhausted, and we will soon be requesting you to give us more of these rods and these injections. So the more people are using, and it helps our women more. So saying these few things, I'm very happy to be in today's program and to have been given the opportunity to launch this in Karnataka, and I'm sure this will be a wonderful thing for our women, and that is what we want. We want to empower our women more. Our women should become stronger, better, and contribute more to society. Thank you.